Now I'll call upon our next speaker, Dr. Arpita Kulshetra.
So, good afternoon, everyone. I'm Dr. Arpita Kulshrestha, and I'm here to share our experience of combining vectored thermal pulsation therapy and omega 3 fatty acid supplementation in meibomian gland dysfunction. So, the two treatment modalities we combined, one of those was vector thermal pulsation, which was delivered with the help of LipiFlow, which is the FDA approved thermal device, which applies heat for 12 minutes and followed by peristaltic pressure, which helps in expulsion of the blocked meibomian glands. So it's usually considered in patients who have history of dry eye symptoms with a speed score of more than 8. And what's important is the dropout area of meibomian gland should be less than 50% on gland imaging, as it won't be efficacious if there's significant gland atrophy. And it's usually contraindicated if there's active ocular infection or inflammation in the eyes, or if there are any eyelid abnormalities. The second treatment modality that we used was omega 3 fatty acid supplementation. So, what we already know is that omega 3 fatty acids are anti inflammatory and omega 6 fatty acids are pro inflammatory. And it's a balance between these two which is critical. So, overwhelming the metabolic pathway with omega 3 fatty acids would lead to a competitive inhibition of omega 6 fatty acids, reducing the overall inflammatory state. And it was also hypothesized that it would change the fatty acid composition of the meibomian lipids, lowering their melting points and thereby decreasing their fluidity and secretion. So several studies have shown conflicting results of omega 3 fatty acid supplementation. So the following studies did show an improvement in various dry eye parameters with omega 3 fatty acid supplementation. However, this DREAM study, which was a large multicentric randomized controlled trial, showed that omega 3 fatty acid supplementation was not significantly beneficial compared to placebo in moderate to severe dry eye disease. So our research question was whether combining omega 3 fatty acid supplementation prior to VTP would be beneficial in the management of MGD compared to monotherapy with the two alone. So our primary objective was to analyze the combined effect on meibomian gland function as seen on LipiView interferometer, and our secondary objective was to analyze change in other dry eye parameters. So ours was a longitudinal prospective interventional study with 3 arms. The first arm received omega 3 fatty acid supplementation of 1200 milligrams per day for 12 weeks. The second group received a single session of VTP, and the third group received combined therapy. Omega 3 fatty acids were given for 12 weeks with a single session of VTP at 6 weeks. And the parameters were assessed at baseline, 6 weeks and 12 weeks. So patients who had a lower lipid layer thickness of less than 60 nanometers, a speed score which assesses the subjective dry eye symptoms of more than 8, and meibography showing more than 50% of gland occupying lid area were included in the study, and patients who had any active inflammation or dry eye secondary to other causes were excluded from the study. So we assessed the subjective symptoms with the help of speed questionnaire. The tear film breakup time, ocular surface dye staining, Schirmer's 2 were also assessed. The meibomian glands were assessed depending on the lipid layer thickness, partial blink rate, and meibomian gland imaging, as well as meibo scoring was done, which is essentially based on the number of glands plugged and the quality of secretion. So what we found was all 3 groups showed an improvement in lipid layer thickness from baseline, and this difference was statistically significant in the combined group compared to the omega 3 group alone. The subjective symptoms as assessed by the speed score also showed improvement in all 3 groups at from baseline. However, the groups where the participants were subjected to VTP showed a great, that is the VTP monotherapy group, and the combined group showed a greater improvement as compared to the omega 3 group alone. The meibo score also showed an statistically significant improvement in the combined therapy group compared to the baseline as well as compared to the other groups. The tear film breakup time improved in the combined group alone, but there was no statistically significant difference between the 3 groups. The Schirmer's 2 improved in all 3 groups. However, there was no improvement which was seen in the partial blink rate or the meibomian gland area. So what we concluded was there was a significant improvement in lipid layer thickness, subjective symptoms, tear film breakup time, and meibum quality achieved in the combined group compared to the monotherapy groups alone. And we concluded that combined therapy with omega 3 fatty acid supplementation could be offered as a novel therapy to patients with MGD, especially those who have a sufficient functional reserve. So here were representative lipid view images of the groups. So as we could appreciate, the lipid layer thickness improved in the subsequent follow-ups. However, there was no improvement in partial blink rate or the meibomian gland area. Similarly, in the combined therapy group as well and the VTP group, we could appreciate that the lipid layer thickness did improve on subsequent follow-ups with no change in the meibomian gland area. Thank you.